She is Sanghamitra Pal. It was her audiovisual evidence before treatment. Middle one-third and lower one-third deformity of the face, bimaxillary prognathism. Her audiovisual evidence before treatment. So now we'll talk to directly.
What's your name? My name is Sanghamitra Pal.
What's your name?
So we'll talk directly to patient and patient party after reconstruction of face by Dr. Anirban Sengupta. So this is Sanghamitra, the reconstruction done. What about the date of today, Sanghamitra?
This is 9th March 2014.
This is your photographs.
Yeah, before the procedure.
And this is you.
Yeah.
How it's possible?
Yeah, it is by the advancement of medical and scientific technology whose name is FACIOMAXILLARY reconstruction.
Who had done it?
Dr. Anirban Sengupta.
Any painkiller tablet?
No painkiller.
Any extraction of teeth?
No extraction of tooth.
What's the experience of your parents?
Everybody is saying that your face has become amazing.
Okay. So when your main treatment was done?
The main treatment was started on the March with before the operation. I did a perity laser to clean my teeth and then clear the inflammation of the gums.
Very good. After that?
After that, there was a technical measurement for the reconstruction ring for the deformity of my lower jaw and the upper jaw.
Okay.
Then,
so have you seen any project before that to see the predicted facial profile?
yeah, I underwent to some of the projects.
Okay. So can you introduce your patient party to our journalist team?
Yeah, yes.
Who is she?
Yeah, she is my mother, Mrs. Lopagundropal.
And?
My father, Mr. Utpalendupal.
What is your mother?
My mother is a mathematics teacher
Where?
in St. Francis Xavier School.
Okay. And your father?
My father is a retired paint technologist officer.
Okay. From your childhood days you were staying in India?
Yeah. First 6 years of my life I used to live in Dubai, United Arab Emirates.
Okay. After that?
After that we came to India.
So at first we have to talk to your mother. Mrs. Pal, we have seen these photographs, and this is your daughter, the same facial profile, just some days before and now. Okay, so how it be possible? What's your view? This was the same girl. This was, and this is now the same girl. So what's your views about this transformation?
Wonderful change on the face after the reconstruction. She looks beautiful, and her confidence level is also increased, and the way of talking, her gestures, the whole personality has changed, has improved. So that's a big change.
Okay, so Mrs. Pal, before doing this reconstruction, is in the virgin state in the world, this subject. So have you gone through any literature or talked to any patient who had done the same treatment?
Yes, on visiting this clinic, I came across some of the patients and had a talk. Right now, I can't recall the names exactly,
okay,
but I had talk, and my daughter also had a talk with
Can you
him.
recall the names, Sanghamitra?
Yeah, it first was Miss Romna Nath, and then was Mrs. Kokumani Maiti,
Okay.
and then was Miss Ornisha Roy, and lastly Mrs. Malati Dash.
Okay, what they said?
They said that they have got a much more confidence level increase, and the increase in self-esteem, and the facial configuration has a total change.
Very nice. So Sanghamitra, we have seen your interview before and now. Can you recognize yourself before?
Yeah.
Who is she? Who is she?
This is myself before the procedure.
But if India is very much famous for any this Idar and Jidar talking and very much conspiracy, if anybody is saying like this, the same pupil or not is a different pupil, then do you have any evidence to prove that?
Yeah, I will prove that a leading man like Dr. Anirvan Sengupta can do this impossible changes, and he can do a miracle job like this.
Any forensic evidence are you having? X-rays and others?
Yeah, definitely I have X-ray reports.
Before and after?
Yeah, before and after.
So madam, being her mother, the beautiful lady Sanghamitra, beautiful girl, what's your expression?
Yeah, I've already said that
Okay.
I like to see her change of personality improvement, the figure and the face, the beautiful face, and the whole thing. It's really beautiful.
Okay, so what about your statement? You are a teacher, so
Yes.
so you are making the future of our country. So what's your statement for the society about this new type of research and treatment?
Oh, well, that I mean, of course, the first thing the parents must take care to see that if the child has got a lack of confidence for whatever be the reason, let alone be the jawline, there may be anything. So to look into that where the lack of confidence lies and to take care of that.
Okay, and now we will come to your husband and your father. So what's your expression about your daughter?
Yeah, the same expression what my wife and daughter do.
And,
The same thing.
and please say about something about this research and transformation of the face of your daughter.
Oh, this is a real amazing change, and we liked it.
Okay. So Sanghamitra, lastly, if anybody is saying from very far from India about your face, is the transformation of you are having now. Okay. So it was previously the some you are having by congenital, and now you are having totally corrected. So what's your statement to the nation that is a changing and transformation of your mental, psycho, and your facial anatomical status?
Like there's a direct relationship between your facial configuration and your the state of your mind. If it in the level of confidence, self-esteem, and your psychology. So if there is a jaw deformity, definitely like it hampers confidence and self-esteem. So once you cure the jaw deformity, absolutely there is an increase in confidence, lower in frustration, no depression, and increase the self-esteem.
Okay, it's a very nice talking you are doing now. So, if we are asking that we are seeing so many braces they are using after extraction of the teeth.
Yeah.
So, what's your view about this matter? Because you have come to Salt Lake Dental Foundation for last 2 to 3 months or 4 months or 5 months or more than that. So, you have seen so many patients who are using braces after extraction of the teeth. What's your view about using these clips?
Like even despite using these braces and extraction of teeth, no satisfactory result has been given to them. So if you go for the for this advancement of this technology, you will get the foolproof result and foolproof satisfaction.
Okay, so you are saying it. This is a result oriented.
Definitely.
And you are having any evidence in the YouTube and the others?
Yeah, definitely.
What about that?
Like I have seen the other patients who have said that they have got an amazing features on the face and the change in the facial profile.
Okay, so you are very much good in English. You are using very good words in English. Application of the similical or metaphorical approach. What's your qualification?
I'm MA in English.
MA in English. So what's your extracurricular activities?
I like reading of books, listening to good quality of music.
Which type of books?
Mainly English books like fiction, suspense,
Okay.
thrillers. And,
Any special writers?
Jeffrey Archer, Dan Brown.
Okay.
They are the leading
Archers,
authors.
which books you are fond of?
Mostly the suspense thrillers.
Suspense thriller.
Yeah.
So there is not any suspense of your face.
Yeah, everybody is saying that. Oh, what's the secret behind such a
No,
transformation?
if anybody is saying this is the Jeffrey Orchard is seeing that this is the face of a girl and this is the face and the skin color, you see the same father and the mother, they are still are besiding you and blessing you, but the lady who is the nucleus of your family, she is totally changed. What Jeffrey Archer will say?
Oh my
According-
God, it's a stunning change. I cannot believe it. That will be his reaction.
Yeah, Here he is using very much sterling words in Nurture's novels and others. And what about your this is the teeth we can believe, but what about your middle third and lower one third? If there is any cut marks.
No cut marks.
Dr. Sengupta had cut you.
No cut marks.
No cut you.
No cut
Acha.
marks.
Extraction of teeth.
No extraction of teeth.
Acha. Any your painkiller or others?
No administration of painkillers.
Nothing.
Nothing. No.
Is it possible so?
Yeah, it is possible because it's a painless technology.
Okay. You can say it in international and national platform.
Yeah, definitely I can say it with full conviction.
Okay. What about your leisure time? How you will pass your leisure time?
I definitely try out new cuisines. I like reading books and listening to music, and yeah.
From Salt Lake Dental Foundation and Research Center,
And,
if you are getting one offer that you will write on this subject because you are very good in English, that you will write
Yeah,
one book and which will be sponsored by any company.
Yeah.
You will write?
I'll definitely write.
Right.
Yeah.
So what will be the introduction of this book? Introductory part, what will be? You will think and say, or you will instantly you can say, what will be the introductory part?
I will say that how the facial configuration of any person changes one suddenly.
Okay. So Sanghamitra, it is a we don't know that anybody will believe or not. We don't bother about that. But the patients and the evidence prove that this was your before treatment facial profile. Okay.
Yes.
And you were giving the interview some months back. Okay. And it is the same person, your parents. You were totally guided by your parents when you were giving the interview here. This is your lateral, this was your lateral portion, lateral view of the face, and your father, your mother. This was your lateral view of face. This is the slow movie we are showing. This was the lateral portion of face, the Sanghamitra, and now the Sanghamitra is this is the lateral views of the Sanghamitra, and this is the front view of Miss Sanghamitra Pal. Okay, congratulations
Thank you.
for your new face and golden future, right?
Thank you.
Okay, and we'll see Sanghamitra in the YouTube. If we'll write on the search option of the YouTube, Sanghamitra Pal, so you'll get everything, right?
Yeah, definitely.
Agreed?
Yeah, definitely.
Bye bye.